Okay, I think I make that on the hour. So welcome everyone. My name is Emily Collard from Public Health England, and I'll be moderating and presenting on today's webinar. So I'm joined today by our panelists, Youssef Kanud from the World Health Organization and Chuck Mention from US CDC. So thank you everybody for joining our 32nd webinar of our weekly webinar series. And welcome to the third webinar in this series about learning lessons from emergencies. So I want to thank everybody for rejoining us, and we're looking forward to continuing the engagement with everyone throughout these informative webinars. So a quick update just to say that unfortunately there's no translation service available today, so we apologise for this inconvenience. We're working to bring it back on online as soon as possible. Just to say that you can, unfortunately, you can submit questions and comments to the Q&A as part of this webinar, and we will be happy to address these questions during the Q&A portion following the presentation. So if you've not already done so, we would really encourage you to join the PHEOC communities of practice on Discord for continuous engagement with the experts and professionals and colleagues through this link. And in addition to this, part of today's sessions will be an interactive discussion relating to learning lessons. So it's a bit of a different way of running the webinar. So we'll have a presentation and then just wanting to get a bit more of that opportunity for us to engage as a community of practice. I very much think that the community of practice is about us learning, not just from the presenters at the webinars, but also from each other. So I'm really looking forward to seeing responses to the questions later. I'll explain more as part of the presentation and about how we're going to run that discussion session. So as part of our ongoing evaluation and continued improvement of these webinars, after this session, you'll see a pop-up poll for you to fill in about the webinar. So your feedback's really important to us and helps us continue to improve these sessions moving forward. So I'd really encourage you to fill that in. We will also have a question at the end of the discussion session, which is about the next series, which is based on the incident management system. So we'll be asking your ideas of topics that you want us to present in those as part of that series. So we would really ask people if they can have a think about whilst we're moving through this webinar about what they might want to see in the next session, which is going to be on incident management systems. So the topic of today's session is about turning lessons into action. So I'll just go onto the presentation. If you just give me one moment and I will present. Okay, can everybody see the presentation? Boemi, is it presenting?
Yes, we can see it.
Excellent, thank you, thank you. Okay, so as I said, this session is about turning lessons into action. So it's in terms of the series overview and the objectives that we presented initially. It's this last one about looking at the importance of action planning and monitoring the progress in the implementation of turning lessons into actions. So today I'm just going to talk a little bit about the way forward based on from the previous two webinars. So this is the last webinar in that series, and we're looking at the way forward. Looking at feedback, the good and the bad feedback, recommendations and action planning, and then partly talking about the concepts of implementing, monitoring and review and progress. So as I said, the next after this presentation, we want to engage participants in a discussion. We'll be using a tool called Menti, and it will explain at the end how to join the Menti discussion platform. But I just wanted to put the questions up initially at the beginning of the webinar, just so that people can have a think about how they might want to answer those questions as we're going through this presentation, just so they don't come as a surprise and then having to think about them at the time. So some of them are just will be just simple yes and no questions. The ones that you can see there that I've highlighted in blue are ones that we would really want some sort of open answers to. So it's really about us sharing our experiences and challenges that we might have had, or looking at how we achieve interaction reviews and the lessons learned process, and making sure that we are sharing that amongst us as a community of practice. The Menti platform will enable us to display the responses as we go through, so everybody can see sort of and learn from each other's experiences. So I'd really encourage you to have a think about some of these questions. Obviously, I'll put them up again at the end, and then we'll go through Menti. So we'll take it slowly. I know this is a new way of working and a new way of running these webinars. So, but we really want to improve and encourage this community of practice, and I really see it's about learning, that sharing and innovating together as a community. So what do we know so far? So the last couple of webinars that we've had have talked about lessons, learning lessons from public health emergencies. So we've talked about that concept of learning lessons, having that process agreed, and getting that written down with who's responsible for doing what in that whole process. So it's not just about the IAR itself or the after action review itself, it's about that whole process. Who's responsible for making it happen, who's then responsible for steering or championing the lessons, action planning, etc., etc. So and we talked a lot about the importance of the senior level buy-in, and gave some really sort of useful practical ways that we can improve that senior level buy-in, and how we can get that more engagement from the senior level. Last week's webinar, we talked about sort of the capturing the lessons. So the tools and the process available is around the interaction review process. So Dr. Mary talked about the whole process of finding out what went well, what didn't go so well in the response, understanding what we can do to improve that response, and then the way forward. So the way forward, I think, is the bit that we're focusing on today. So we've learned about that sort of capturing the lessons and the concept, and sometimes we might think actually that's the end. Sometimes we've done the interaction review and everybody thinks, phew, we've captured the lessons, but I don't think that's the end. The next part, I think, actually is probably the most difficult of the whole process. So turning those lessons that we've captured into something useful is the learning bit. So how to overcome the challenges and institutionalize those good practice. One of the reasons that I'm presenting today is because we struggled to find some experiences or that people would be willing to share. So it's obviously a element of the lessons learned process that's quite challenging and therefore quite difficult to implement. So obviously the next real event or exercise is really the test of only when you've past mistakes are not repeated can we really sort of say that we've learnt those lessons. So we're looking at the way forward, and this is a slide from Dr. Mary's presentation, and she looked at the identification of sort of what can be addressed immediately. So that's coming up with those recommendations from your interaction review and putting them in the report. And as I said, that's not really the end of the process. So there's you know, establishing who is going to then take those recommendations or that action forwards is a really important aspect of it. So, you know, establishing a follow-up team, documenting that progress of in implementing the recommendations, so your action planning, and then following up on that to make sure that things are being implemented, and the approach to ensure engagement of senior leadership. So that's just talking about the way forward. So I know you won't be able to answer out loud, but who here reads hotel reviews or restaurant reviews before you go anywhere? I mean, I do, and I think there's nothing I find more frustrating than a badly written review. So I always think that if I'm going to put the energy into reviewing something, then I want the hotel or restaurant to actually be able to do something about an issue or continue doing something that I thought was a really good practice. In a way, I'm linking that back to lessons learned process. So capturing the discussions and the feedback from an interaction review or after action review is so important and can have such an impact on your ability to draw useful recommendations from that. So if you have poor quality input, you'll inevitably get poor quality output. So that why question that Dr. Mary talked about last week, so really doing that root cause, really asking when participants are given feedback, is to ask the question why, so drill down into the real depths and the kind of the real detail of what those what the impacts of that were on the response, or what enabled them to do that, if it's a good practice, or what were the limiting factors if it's a challenge. So that why question is so important. So I've got here on the screen several different sort of feedbacks that I've just taken from various sources. These ones that are in the smaller speech bubbles. So you've got, and some of these were ones that I've received from various different interaction reviews or lessons learned process that we've done in the UK. So we've got here sort of staff were unprepared for the tasks they were asked to carry out. That's fine, and you might find that as a statement in a IAR report, but it doesn't really tell you much. It doesn't enable you to draw a conclusion as to what you can actually turn into action. So that, you know, there may be various different reasons why the staff were unprepared. This is one of my favorite ones. Is we often, if food is provided as part of a event, sometimes people's feedback is, yeah, the lunch wasn't very good. Why wasn't the lunch very good? Was it just you didn't like the lunch, or say you had dietary requirements that weren't met? So there are all these different reasons why people's feedback, and if you don't drill down into the why questions, you'll get very one-dimensional feedback that you then will struggle to turn into actions. So I've got in this big speech bubble here a slightly better where somebody has drilled down into the asking the why question. So it's based off that staff were unprepared for the task that they were asked to carry out. But many of the response staff members within the team had a different process for completing the handover, and there was no clear process for inducting staff or providing a briefing at the start of the shift. So that is the reason why that the staff felt unprepared for their shift in the PHEOC, for instance. But here it gives you some information as to why that was, and enables you to pull together a bit of a action plan from that. So you can get a recommendation that as part of the PHEOC handover process, there needs to be a clear and consistent approach to handover, and also some process for inducting staff so that everybody has a briefing at the beginning of their shift. Whether that be, however that is, will come later, but you can draw that recommendation from this bit of feedback, because it's more detailed as to the why than the previous one that just said staff were unprepared. It might just be that they turned up and they hadn't done the training, or but it was this one has drilled down more into the fact that it's to do with the handover. So they were unprepared because they didn't have a good handover and there was no briefing at the beginning of their shift. So that just demonstrates the importance of the actual feedback that you get as part of your interaction review, and how it then impacts on your ability to take these actions forwards. So when you've got some good feedback from the interaction review process, sort of with tangible impacts and an understanding of the limiting or the enabling factors, this should allow you then to draw some recommendations for action. So I always refer back to, I imagine probably a lot of people have heard of the SMART mnemonic. So I always refer back to this model just because it's kept me in good company through the years, and it's always a good place to start when you're thinking about objectives or making actions or recommendations. So we're looking at them, your recommendations, your actions need to be specific. So what is it you want to do or change as a result of that feedback? So a good description of this will ensure that the correct action is taken, and that it's not misunderstood if that process is being driven by a different team or a different person. So they need to be measurable. So you need it's important for tracking those actions and knowing when it's been achieved. So referring back to the sort of how do we know we've learned that lesson. If we have it as a measurable, something that's measurable, then we should be able to at least know that we've done it. We'll put here achievable. So there could be potentially information that comes from your interaction review that requires big change. So one that may not be achievable. And this is why we sort of have talked in the webinars previously about sort of senior level buy-in and how important that is, particularly for actions that might be difficult or unachievable. The senior level needs to be able to redirect resources accordingly or accept that risk to the organization. So the achievability is really something that needs to be considered, and is an important part of your sort of action planning and your recommendations. So it needs to be relevant. So is it an action that your organization has control over? Sometimes these processes, so your interaction review or after action review, might throw out things that actually were not within your sphere of control. So if the change is relevant for future responses, or is it relevant for COVID? So neither is wrong, but it just needs to be considered. So you just need to make sure that the relevancy and then maybe passing on some of that learning, or if there has issues been flagged that were maybe the responsibility of another organisation, then it needs to be sort of highlighted that may need to be communicated, or those sorts of things. Again, the senior level buy-in is really important there, because there's a lot of other sort of politics involved in sort of cross-organizational learning. And then time bound is the last element for your recommendations. So you're looking at these sort of as a way to prioritize your actions, but also ensuring that they have achievable deadlines. So there's two things there around the sort of time element to it. So your action planning. So this is just a couple of examples of action planning. So there's various different templates available on the internet, or from partner organizations, or indeed from your own organizations. So these differ from sort of simple word tables in a Word document, or a fancy Gantt chart in an Excel spreadsheet, or some organizations may even have sort of an integrated IT system. So it's probably worth considering how your organization usually plans and tracks activity. So you may find it easier to get people engaged with it if it's more familiar to them. So I've just put a couple of examples. Obviously, the WHO interaction review and after action review process uses those activity sheets for us to record. And it's got all of the sort of key elements that you might want in your action plan. So you could easily transfer these onto some sort of Gantt chart, milestone tracker, which I've also put an example of, which has got, you know, the sort of the description, who it's assigned to, progress, etc. So the key elements of an action plan, you want to include the sort of the specific action description, the action itself. Then how can it be broken down into steps or smaller activities, so sort of milestones or activities. And then who is responsible for implementing that action, or who is the focal point for coordinating the activity? That's a really important thing, because especially when you're doing your feedback or anything like that, that's a really key point to make sure that there's somebody assigned with responsibility. Otherwise, the action will sit there with nobody coordinating it or nobody responsible for actioning it. It will be difficult to progress. So you want to also be aware of what the resource requirements might be for an action or an activity, because again, as I said earlier, talking about the sort of achievability, the resources required in order to achieve some of these actions needs to be considered as part of that achievability. You then obviously want to know what the deadlines are, and that's, I think, an important thing. So again, the prioritizing enables people to prioritize and also follow up and make sure that we're sticking to the plan. And then indicators of achievement. So how do we know that it's been implemented, and what are the outputs and the outcomes? So as I say, there is sort of no real one template for that, and people may be looking for support with building these templates. And I think if they have those sort of key elements, so that I've just gone through, I think that's a really good starting point for a simple action planning tool. I'd be interested actually to if people have got any experience with action planning, if they want to put in the chat function of this webinar, whether what sort of templates they use, or if you have a particular system, or however you engage with that action planning process. We'd be really pleased to hear about it, and I'm sure the community will be good to learn from each other in that aspect. So implementing, monitoring and review in progress. I mean, the implementing bit is the really difficult bit. I think this is where sort of having your agreed lessons learned strategy or process is going to be of most use. So the organization needs to be able to implement the activities to demonstrate the improvements. Otherwise, you know, the effort that people have put into the interaction review or the after action review will be wasted. So we talked earlier, obviously, as part of the interaction review, there's a recommendation that you establish a team to follow up after the interaction review. So someone that can champion the progress or steer or coordinate the monitoring review and the implementation. I think that's a really key part of it. So ensuring that your action plan is communicated, so those responsible for the actions and any relevant stakeholders, making sure that plan or the recommendations that have come from your interaction review report is communicated out to the relevant people. Otherwise, you won't get any traction with with implementing those actions. So then also looking at regular updates on progress. So this could be like meetings or workshops, but it's about bringing together those people, again, that are steering or looking at implementing these actions so that you can come back and really look at what that looks like and make sure that you're getting regular updates on the progress. So also you want to have a clear governance on so that everybody understands what the process is. And again, that's where you're sort of, if you've documented your agreed lessons learned process, that should help with setting out that clear governance. So the outputs of your your action planning, you know, can be used for various different things. If there are any sort of plan reviews, you know, upcoming, and then any recent sort of interaction review reports or recommendations would probably be worth considering as part of that plan review. So there may be relevant recommendations for the plan, and sharing those recommendations as well as the actions that have happened as a result will help other teams or departments or organizations to learn as well. So that's kind of just a brief overview, I think, of the sort of post-IAR process. I've talked quite a lot in terms of sort of concepts, really. As I said, it's the most challenging part of that whole process. And I think if anyone has anything they would be willing to share about the post-IAR process, even if it's challenges or issues that you've come across, I think we can all learn from each other in that aspect. So that would be really useful. I think we'll try now and go on to the community of practice discussion session. As I said, this is a new way of doing things, so please bear with us as we move through this this session. So I've just put, again, the questions up there. I just want to check the chat. Hopefully Yusuf and Chuck are keeping an eye on the chat. I'll just leave the questions up there for people to have a look at first. And then I will move on to the next one. So the community of practice discussion session. So it's using a platform called Menti. The web address is there, and then there's a code that you put in. And then it should be it should take you through to the sort of questions. that we've got. So please don't log out of this Zoom meeting. It will hopefully, I'll display the results on the screen, so I'll present what we're doing here. You can access Menti either on a separate browser window if you're on a laptop, or if you've got a mobile phone, a smartphone, then that would be the interface on a mobile phone is really good. So if people can do that whilst I go and find the session. So as I say, this is about learning, sharing and innovating. So I really, really want to encourage people to engage with this discussion session. It is us asking you questions instead of the other way around. You will have the opportunity to ask us questions later on, but I really wanted to just get a feel for the community, and you know, we're all working in this field, so it's a really kind of safe space, I think, for us to be able to share some of that learning, and any innovations that we have in this field are, you know, greatly appreciated. So I shall leave that. I will stop sharing for the moment, and then I will share the Menti thing, and it has the web address at the top anyway, so don't worry if you haven't gone onto it yet. I can see people are already.
I have dropped. Do you?
Say again, Yusuf?
Yes, I'm just saying I have dropped the link to the Menti and to the code for the participant to quickly find it.
In the chat?
In the chat box. So you can just click on the link and you have over.
I can see people are already on the coffee seems to be, and water seems to be at the moment people's favorite beverage. This is just a starter question to get people familiar with the Menti platform. As I say, it's something that we've not used in this webinar before, so I really appreciate people's engagement with this. Still water and coffee, the most popular. Vanilla milkshake, I like vanilla milkshakes. Not a big beer fan though. So we've got about 18, 19 people. It's just because we've got about 138, nearly 140 participants on. So I'll just give people a chance to get onto the platform and start the process. I forgot to ask Yusuf, can everybody see the display of the?
Yes, I can see it.
Excellent. Okay, I'm probably going to move on to the next question, and then if people want to, as I say, the code and the web address is at the top of all of the pages. So if you want to join halfway through and give some feedback, then that would be really appreciated. Or if you just want to see what the responses are, that's also okay. As I say, this is about the community and learning from each other and sharing some of that learning. So some of these questions, as I say, are sort of simple yes and no answers, and it'd be really interesting to kind of see the experiences of people, or what engagement they have had with this process, but also to with the open questions to really get some good kind of experiences that people have had. So I think we're still getting people joining, so I'll just give it one more minute. So I'll skip on to the next one now. So hopefully the system should take you on to the next question. I think sometimes it says that the presenter has moved the slide along. So if you press skip to the next slide, that should work if people are struggling with that. It's quite even, the amount. So this question is about, have you ever participated in or given feedback as part of the sort of a formal review, whether that's like a interaction review, after action review, or like a debrief or anything like that, as part of a sort of looking at an emergency? So that's interesting, about balanced. And I can see someone in the chat has put no, they haven't. So that's fine. Okay. So that's really interesting. So those of people that have participated in interaction reviews or after action reviews previously, we'll be really looking to you for your experiences as part of that process. So hopefully people will be able to share some of that in the coming up questions. I'm just going to skip on to the next question. So have you ever facilitated or delivered an after action review or interaction review? So been part of the planning team or the sort of delivery team? This is like the opposite, isn't it, of you know, not having to give feedback, but having to manage the feedback as part of an interaction review or after action review is often down to sort of the emergency preparedness staff or your EOC staff in order to facilitate this process. So it will be interesting to see how many people have been part of that. Quite a lot haven't. So hopefully all those that haven't facilitated or delivered an after action review, if you ever are part of that process, obviously Dr. Mary last week was talking about the toolkits that are available on the WHO website, just to support people that possibly have never delivered or facilitated an after action review before. They're really helpful in sort of, you know, supporting that process. Okay, I'm going to move on. So is your organization's lessons learned process agreed and documented? Do you remember in the first webinar and this one, I've talked about the importance of getting that process agreed, particularly around your sort of if you've sort of getting that senior level buy-in is really important, and having your process documented is so it looks like yeah, so Nigeria has theirs documented, Namibia, lots of people haven't. So with these word clouds, the most popular answer comes up in bigger writing. So know that the process isn't documented or agreed is the most popular, but there's lots of countries there that have theirs documented. I like this because we can see from how globally our participants are from. So, but still, I think, yeah, no being the main answer there, but some useful knowledge on the countries that have had the process. So, you know, if your process is agreed and documented, then really encourage you to sort of maybe on the Discord platform and as part of these webinars is to share sort of, you know, how you've documented your process, or how it was agreed, you know, were there challenges that you had to overcome, anything like that. You know, just sharing the knowledge on those will be really useful. Okay, I think I'll move to the next one. I'm just keeping an eye on time because I want us to have enough time for questions and stuff at the end. So we've got, what challenges have you experienced with documenting your lessons learned process? So this will be the people that have actually had their sort of process documented. So what sort of challenges did you come across? I can see a couple of people in the chat are just, having issues with the Menti platform. If you've got sort of answers to the questions and things, I'd be really happy if you put them in the chat, just so that we can capture them, and because people can see the chat as well. So this question is about what the challenge is. So sort of agreeing on the outcomes. Yeah, that's a common one, I think. So there's not enough time. Getting issues corrected in a timely, defining realistic actions. Politics seems to be a common theme here. Time is definitely one. I think that resources in order to implement it is always going to be a difficult one. I think especially as you know, if you want to agree somebody to take responsibility for that process, then having the resources in order to do that, especially during a response, and especially after a response when everybody is absolutely exhausted, having to then keep that momentum and pursue your after action review or your interaction review process while responding is often really difficult. But maybe by documenting your process, you're giving it some importance, and some getting that senior level buy-in is sort of demonstrating how key it is to improving the response in the future, and all of those sort of benefits that we discussed in the first webinar. So I'm just scrolling through so people can see the different responses that we've got. Some really useful feedback here. Yeah, so that's one I was just talking about. So following on from a response once an emergency has been dealt with, lack of political will or lack of resources mean it can be difficult to get that senior level political buy-in. And actually that happens even if you've got your process documented. You still might struggle to get engagement with that process, even if it's been agreed at the senior level. It doesn't always mean that well, as we know as emergency planners, a lot of us, that even if you've got a plan, it's been agreed and signed off, doesn't mean that they'll follow it. So that's often a bit of a challenge. But as I say, we talked a little bit about in this webinar just now about the having a team there to support and champion it. So maybe trying to have those a bit separate from your response, so that you've got somebody with that's not exhausted from the response, that was part of it but not necessarily had a big role in it. So some really good feedback here. Inadequate data management, yeah. Seen as a witch hunt, yeah, I think sort of that expressing to people, and we talked a little bit about that sort of learning culture, and making sure that it's not there to personally it's not an external review, or shouldn't ever be used as a way of penalizing an individual. It's about the process. It's about making improvements to the process and the system. So, but that comes as building that learning culture, and we did talk about that in the first webinar. If people want to relook at the presentation or the link, or re-listen to it, it's on Discord platform. So we talked about a little bit about looking at the scale of your lessons learned process and making sure that you're not trying to go too big and keeping it small. Right, I will move on to the next question. Some really, really good experiences there. So thank you everybody for engaging. So what would you see as the sort of key enabling factors for your IAR? What's out there that's useful? What's out there that's helping us to achieve these IARs? I know one thing is the WHO toolkits. Some good ones here. Need for continuous improvement, yeah. And you'll note this is a little bit like doing a interaction review. I've tried to use some of the familiar language and things, so that we can try and improve that engagement and the kind of feedback. I talked about how important good feedback is as part of this process. So trying to sort of get increase that familiarity with the process and things. So this automatically scrolls through. So yeah, we've got senior level buy-in is strong senior level support will be a real enabling factor. Support from partner organizations, good collaborative relationships between the different teams. So you've got the continuous technical guidance. Team spirit. I like that one. So that it has to be a top-down and a bottom-up approach in parallel. So you have to get the engagement from all levels and make sure that you can continue that learning lessons and improving that learning culture. Great, I'll move on to the next one, recognizing I need to speed up. In one word, can you describe what you feel is the most valuable outcome of the learning lessons from public health emergencies? So what's your key takeaway from the lessons learned process? All great words. Better, stronger, improved. That could be the strapline for the interaction review process. Preparedness in the future. Improvement. Resilience. Motivation. Knowledge sharing, that understanding. We talk a lot about the sharing, the learning, and I think the understanding is one of the key bits. Because in order to improve, people need to understand what were the issues in the first place. So without understanding, it's very difficult to move forwards. Excellent. I think improvement and preparedness seems to be the key factor here. Excellent. So this is one of the questions that I really wanted to ask, and I think really draws out that sort of community of practice element to this. So how as a community can we improve this process? So we've talked about in these webinars all of the sort of concepts and the things, toolkits, etc., that are available now. But is there any sort of, this is the innovation bit of the community of practice that I wanted to draw on. Has anybody got any sort of ideas of how we can improve that, these processes? Certification, that's a good one. So I like that, encouraging the culture of learning. And we talked a little bit about like kind of keeping that small, within your own areas of influence. So your team or, just you as an individual. Ownership, I think someone's written there. I like that. And one of the things that I really is that this is the IAR and the AAR are not the end of the process. This is the beginning of the process. And the more you build it into your structures, your response procedures, you're going to foster and build that sort of learning culture. Excellent. Some really, really, really useful things here. Standardization. I mean, I know there's quite a lot of tools and templates available, but something that there isn't sort of a standard template is for that action planning. So I wonder whether that's something that we as a community could establish. Right, excellent. I'm just going to move on to the next question then. This is just a sort of to refresh your knowledge. So the outcomes or outputs of lessons learned have many uses. Can everybody rank these in order of importance? This is because I wanted to use the rank one on the different method on the Menti platform. I wanted to see how it would work. It seems improving response capability seems to be the most popular as the first. And that's shared learning. So improving response capabilities and the shared learning, I would say probably for me, the two most important aspects of it. And that improved decision making, we talked about how decision makers can use the learning from incidents to improve their decision making in future incidents. So okay. So I think the next question is the last question, and it's more relating to the IMS next series. So if people can have a think about that. I'll just wait few more seconds so people can answer this one. Excellent. So as I said, the next series in the webinars is going to be about incident management systems. So we would really value your input into the sort of topics that you want us to cover as part of that series. So we're always coming up with ideas for the webinars and to get presenters, but it'd be really useful to have feedback from you as participants in the webinars as to what you think would be some good topics. So maybe think about areas that have been a challenge as part of the COVID response in your IMS, in your incident management systems, or any areas where there's sort of some really, really good practice that you might want to share as part of that. So have a think about those sorts of things. And I forgot to say, I can download the responses as part of this. So we'll put those onto Discord so that people can go back and see what the responses were, so that we can improve, as I say, that sort of shared learning. I can see there's a couple of people in the chat that have said they've had issues with the platform. I apologise for if you've been unable to share your answers. If you want to engage, as I said, we'll pull these off of the system and put them onto Discord, so you can always add any sort of learning or your answers to the Discord platform, or indeed put them in the chat here, and we can sort of try and add them to the presentation. So I think if everyone's, I'll give a couple more minutes because we want to get some good ideas from people on this. So see more responses coming in. So I've had about 22 responses. Okay. If people can finish off giving their suggestions, I'd be really pleased. We've got quite a few there, which is great. So some food for thought that we can continue with the next series. And then I will exit out of this. I think I will stop sharing, but I'm going to leave that one open. So if you have got it on your phone or whatever, and you're still thinking of some ideas, I'll stop sharing it on here, but I'll leave it on that page just so that you can continue to input your ideas if you want to. So we can get as many as possible. So I think Youssef and Chuck, if you're able to sort of, I know we're running out of time, but we got any questions and answers in the.
Hi,
Q&A?
Emily. There was a couple of questions that had come up, and one in particular was about what is the recommended time frame for an IAR?
I think it's on. I think it's something like within sort of 6 weeks of a sort of. Well, oh no, sorry, that's after action review. So an IAR, I think, is if you've got a sort of prolonged incident at a reasonable time. So that might be sort of after it's been ongoing for maybe 1 month or 2 months, or if you're going into sort of a different phase of the incident. I don't think there's sort of a tried and tested, as Dr. Mary was saying last week, the interaction review process is a reasonably new process adapted from the after action review. I know after action reviews are sort of recommended to take place within sort of 6 weeks to sort of 3 months after your close of your incident or your emergency. So I think with an interaction review, it's about finding an appropriate time that's not too long into the response, so that if there's any sort of immediate needs or immediate recommendations or changes that need to happen, you can sort of implement those straight away, and then sort of pick up on your more longer term ones afterwards. And the interaction review process, actually you can set it up so that you have them at regular intervals as part of your response. So COVID in particular, obviously it's been over a year now, or just over a year that we've been responding. So if you had an interaction review maybe at the 6-month mark, then maybe have another interaction review in after the next 6 months. Yeah, I don't think there's necessarily a tried and tested time frame, but if anyone else has any sort of better recommendations, then yeah, please do say.
Thank you very much for that, Emily. And I would tend to agree with you. I think it hasn't been a set, it must be done in this particular time period, but you do want to try to practice conducting those as close as possible to the event that you are either in or evaluating. The next question is a two-part question, and it comes and as, what are the main responsibilities for the IAR follow-up team, and what are the challenges they face?
Okay. So in terms of responsibilities, I think their main responsibility, I think, is to pull together the information from the interaction review and make sure that it is available on a action plan, and then to move the process forward. So to have ownership of or responsibility for organizing the sort of workshops where you might want to discuss the prioritization of those actions. I think the team itself is more of a to do some of the documentation and to really champion the process, but the action planning and the implementation of those actions needs to be a whole organization. It needs to be a whole system responsibility, or an organization responsibility. Otherwise you'll find that the team itself, the follow-up team, shouldn't be responsible for implementing all of those actions, but they should be responsible for driving that process forward. So making sure that everything's documented, that you've got that they're organizing the sort of prioritization workshops, organizing any progress reviews, bringing the people together, make sure that it's a coordination role, I think, more than a responsibility for actually doing the actions. And as the challenges are I guess the common challenges in finding people's time and to come together, because it needs to be a sort of collective, collaborative process. I think one of the biggest challenges is getting that time for everyone to come together and talk about those, prioritizing those actions. Getting the updates, I think, will be quite difficult, or a challenge. And yeah, I think it's maybe the senior level buy-in again is one of the challenges, to make sure that you can demonstrate the senior level buy-in to the people that are responsible for carrying out the actions or the implementation.
Thank you very much for that, Emily. I agree. You, sir, go ahead.
Just to continue on the same line with Emily, I think she really rightly said it. Those people in charge of following up the implementation of the lessons into transforming them into real actions, going through a lot of challenges, and I'm glad to see that during the Menti little activity we did, participants had a chance to manage many of those challenges. Of this is misunderstanding about the action review as being seen by some people as an evaluation for individuals. So I think with this misconception is extremely important and has to be also the responsibility of the team following up on the implementation lessons to develop effective communication tools and strategies so that people understand that this review is about the system. It's the business, how the business, but about individuals. Over.
You cut out a little bit there, Yusuf, but I think you were basically saying that, yeah, it's the it's that championing the process and making sure that people understand that it's not a review of an individual's behaviors or their actions, but a whole system, looking at the whole system and making sure that people understand that and are on board with it in order to progress through the action planning and implementation.
Yes.
Great.
Exactly. Sorry, having some issue.
That's okay. Chuck, I don't think, is there any more questions? I think we're probably running out of time, I think, for questions, but I can answer some of, if there's any other questions in, and then put it onto Discord.
I think another question, Emily, was when the review is done at a subnational level, so, you are most likely to find yourself with poor by the district level or the national level authorities. That was also one of the questions, and I think it's it has been highlighted by the participants themselves on the Mentimeter. So the whole government approach and maker with the all relevant stakeholders through a whole process of the interaction, as well as during the phases of implementing those the lessons and recommendations to come to action. Over.
Yeah, so I think so you're saying if the IARs are happening at national level, sometimes, or the subnational level either aren't involved, or then there is difficulty in getting some of those actions implemented. I think that's probably part of the responsibility of this, the follow-up team, is to make sure that the right people are involved, and that needs to be at all levels. And the agreement to part of the one of the great things about the IAR process itself is it draws out and gets that kind of collective understanding, as well as collective agreement on what the recommendations or what your improvements need to be as part of that system, as part of that interaction review. So if you've got the right people involved in those discussions, then that should go partly towards helping to get that sort of whole system understanding and agreement on what needs to change or what needs to be implemented, and that should help towards the buy-in if people have been part of the process in discovering what these kind of challenges or good practice has been, and they're given the opportunity to share, then you get a lot more engagement in the process. So I think that's.
And I think it's also really crucial to put more emphasis on the fact that people need to know that this whole thing about finding basis to update, to validate any existing national strategic response response plan for better preparedness for future pandemics, any kind of health incident. Yeah, over.
Great. Thank you. I think we probably haven't got any more time for more questions. I just wanted to say thank you for sort of everybody's participation and engagement. I hope you enjoyed the mentee aspect of this sort of community of practice. We got some really good responses, and as I say, we'll try and share those onto the Discord platform so that people can continue to sort of refer to it. We will have also on posted onto Discord is the quiz. So the quiz will be about all three webinars in this series, so that we can continue to learn, and that will be a certificate. Once you've done the quiz, you can get your certificate in the same way as we've done previously. You will have seen the poll that popped up to fill in about the webinar, which, as I say, we really encourage people to fill that in, and your feedback's really important to us. As I say, next week's webinar will be about the IMS, and so please keep an eye out for the flyer that will come out to explain what the topics are. And we've got some really good feedback. I think I can see I've got about 45 responses now about suggestions of topics that we want to cover in this next series. So thank you for your input, and we will have a look at those and try and make sure that we weave them into the series and do some really focused webinars and sessions on those. So I just wanted to say thank you to Chuck and Youssef for helping with the Q&A session and managing the chat as we've gone along, and thank you to everyone for your sort of participation. We're looking forward to everyone joining us for next week's session in this series, and we hope you have a great morning, afternoon or evening, depending on where you are in the country, in the world even. And thanks again, and we'll see you soon.
Bye, Emily.
Bye.
Bye, everyone. A lot. Have a good.
Thanks, Youssef.
Thank you.